And just know that, being able to talk to your doctor via telemedicine visit, even if you are having fevers or the symptoms of COVID-19, that you can get tested and not actually have to be seen in person, but just go to get the test done and then continue to isolate and quarantine yourself.
Hello, and welcome to the Homepage Network. I'm Sarah Vogt. Joining me on this broadcast of Moving Together is Dr. Kyle Ambarski of the Laurel Health Centers. Today, our focus is, what can we do if we're sick or injured and need to be seen by a doctor? Or are there good protocols in place at my doctor's office? First, Dr. Ambarski, I'd like to share my own experience during COVID-19 that happened on a snowy, beautiful day, Saturday, April 18th. 6 inches is a lot of snow for my little tree to bear, so I grabbed my trusty broom and went outside to rescue its branches so they would not be broken. I slipped and fell hard, so I immediately went back into my home where I told my family what happened, and they all prayed with me. Then I decided to call the Laurel Health Center here in Wellsboro and ask for you, but you were not available. So they gave me an appointment right away with nurse practitioner Jessica Zingerle, who took great care of me. She examined me and sent me for an x-ray at UPMC Wellsboro. I broke my left distal radius, hence my ortho appointment supplying me with this beautiful blue Movin Together cast for me to wear to protect my bone. Dr. Ambarski, why was it so important for me to be seen right away after my injury?
Yeah, so anytime somebody gets hurt, we can't always see the visible damage. The reason for getting the x-ray is to make sure that the bones were aligned well and not offset, and also to make sure that you are what we would call neurovascularly intact, making sure you have good blood flow to that area of the body and that you can still move and that you can still feel everything as well. Because if not, then it becomes even more of an emergent getting surgery.
Mm-hmm. If you wait, right, like you talked about surgery, if I had waited for the way my bone broke, I could have had to go into surgery.
Yes. It depends on a lot of factors and where the bone is broken and what is going on. So it's always a good idea to seek medical help in that situation. And a lot of times you'll know if you have a fracture because it's usually a lot of pain that you're not used to. The body will tell you by you continue to, oh, wow, it's still painful, it's not getting better.
Mm-hmm. Oh, I definitely had pain, Dr. Ambarski. There was pain talking to me for sure. How can we help keep our bones strong?
Yeah, so especially when it comes to the aging process, it eventually develops some type of arthritis, and the bones do thin over time. So it's important to get your vitamin D levels checked, especially in the area where we live, along with maybe your calcium checked. And then also there's certain things like DEXA scans that can look to see how healthy your bones are, and get it in to see a medical provider to discuss the family history as well.
Mm-hmm. Well, going forward, I'll be making appointments with you to assist me in finishing this bone race strong, because everything you just talked about, I've never had before, like the DEXA scan and checking my vitamin D. So I know there's things that I can do to help my bone health be better. If others who are viewing this broadcast need to see a doctor at this time, what are the safety protocols in place at the Laurel Health Centers?
Yeah, our administration from top to bottom has done a fabulous job with the COVID-19. Some things that they have been implemented is staying in your car until we're ready for your appointment. So some people might show up a little early, and instead of having people in the waiting room around other people that may be contagious, we call them when the appointment is ready and bring them right back into the room where they would be seen for the appointment. The other thing we also do is we also offer a mask for all the patients to have on, and throughout the day, all the providers also have masks on as well. Mm-hmm. We have hand sanitizer, soap and water, and all the good hand hygiene. Mm-hmm. The last thing that is also very beneficial that we do is we do telemedicine visits, something very similar to this video broadcast. So can actually look at somebody's arm, they can hold it up, or they can show me a rash, or they can show me what their concern is. And from there, I can get a better idea. Is this something that needs to come in right away to be seen? Or is it go to the emergency department because it is an emergency?
What encouragement would you give to those who are watching about COVID-19?
Yeah, so I've actually been following the news broadcasts and reading the CDC updates along with other medical journals. Unfortunately, right now, there's a mix of opening, which I think definitely has to happen here at some point. But just know that we're all in this together, and that, in this area, we're very fortunate where we live. We don't have near as many cases as other parts of the country. And just know that, being able to talk to your doctor via telemedicine visit, even if you are having fevers or the symptoms of COVID-19, that you can get tested and not actually have to be seen in person, but just go to get the test done and then continue to isolate and quarantine yourself. Mm-hmm. The good thing is, living in an area like we do, there's a lot of availability to get outside, to go for walks, go for hikes. And that's important. Also, just keep you sane as well, because anybody who's in a house for this amount of time so is getting anxious and getting all the news that we keep reading.
Well, I had worked through my anxiety and fear about COVID-19 initially, and so I was taking walks and I was going outside, and that's why I went out to rescue my tree. So I think it is to be good to be outside. It's good to be outside to experience the beauty of where we live. It's just wonderful to have that opportunity, and I don't regret trying to rescue my tree, Dr. Anvarsky.
Yeah, hopefully more snow in the future.
I love that tree. So I'm so glad that I had the opportunity to be outside, and I'm going outside again really soon too. So, well, there's a special thank you to you for joining us for this broadcast today, and for the work and care that you do in our area for your patients, and we really appreciate that very much.
Thank you.
And lastly, a very special, heartfelt thanks to all healthcare professionals who are helping me to heal, and to my family for cooking meals, cleaning the house, and even helping me put my contacts in. Thank you to the homepage staff for helping me without the use of my left hand. Thank you to my Heavenly Father for all of His blessings. And thank you for joining us today for Moving Together on the Homepage Network.
The Mansfield Laurel Health Center is now accepting patients in the state-of-the-art Susquehanna Health Medical Plaza at Mansfield. In the same facility, Susquehanna Health is offering physical and aquatic therapy, imaging, laboratory, cardiology, and sports medicine services. For more than 40 years, our 6 Laurel Health Centers have provided high-quality, compassionate care to the residents of Tioga County, offering family-based primary care services, obstetrics, pediatrics, preventive screenings, and diabetes education, as well as outpatient counseling and therapy services. Our passion is to provide comprehensive health care to all who need it with dignity and respect.